Maybe you can just start by introducing yourself and what background you have.
Okay, my name is Jim Mellon, and I'm an entrepreneur investing in biotech-related opportunities, and indeed in creating some biotech opportunities. I was formerly a fund manager when I was about your age, and then I started branching out into other stuff, including investing in property, creating new companies. And then for the last 15 years or so, I've been involved in biotech. And the two key strands of that at the moment are in longevity science, which is, I know, what you're interested in. And then in the other part of the equation is in the cellular agriculture field, where we've created a couple of companies that, one of which is listed on the London Stock Exchange, that invest in alternative protein sources to effectively help decarbonize the world and to reduce animal suffering. So those are the two areas that I'm concentrating on at the moment.
And so focusing on the aging part, what made you go into specifically aging as opposed to other fields in health and medicine?
Oh, very good question. So my partners and I in biotech, a man called Dec Dugan, who was formerly the head of drug development at Pfizer, which, as you know, is the world's biggest pharmaceutical company. And then another partner of mine I've been working with for a long time called Greg Bailey, who's been responsible for funding a number of biotech companies. We have started some biotech companies in the last 10 years or so. One is called Biohaven, and it's got a drug on the market in the US now, and for migraine, for the terrible headaches that people get. And that we started 5 years ago. It's listed on the New York Stock Exchange. It's worth about $5 billion. And so when Greg, who's a fitness nut, was talking about what he could do to make himself healthier in later life, and his interest was largely in sport and in diet and so forth, I took a greater interest in the science behind longevity. And I researched a book, and this is about nearly 4 years ago now, called Juvenescence. Talked to the key opinion leaders in the field, went around the United States and visiting them and in Europe. And that became the basis of our company, Juvenescence, which is focused on improving healthy aging, and also ultimately in trying to add some years of healthy life to for the benefit of humanity. And we've raised that company, which will go public sometime in the relatively near future. We've raised about $250 million of equity for that company. So I think it's the largest amount raised for a specifically aging related company in the world. And because we have experience in biotech, and we know that not everything, as you will know, not everything works, even if it looks great in a business proposal, it doesn't always work. We've made multiple bets. So we've invested in quite a number of enterprises, which we've mostly started across the gamut of aging-related projects. And one or two of those companies are now in the clinic. One of our consumer products is on the market in the United States, which is a ketone ester, highly potent ketone ester. And as I said, we're going to go public in Europe in the next few months. So it's exciting times for us.
Sounds cool. Yeah. Do you then yourself take any vitamins or your own product to extend or to try to live healthier yourself?
I try and live healthier, but I don't always succeed. But I'm doing basically what we are in our aging field is in a very early stage of development. I mean, I absolutely believe that life expectancy at least will be longer, considerably longer in the next 20 or 30 years. But we're in what I call the dial-up phase of the internet, the very early days of the internet, which I remember quite well, when there was a sort of beeping on the line. No one was really sure what the internet was for, and now it's seamlessly integrated into our lives. And so although we don't know exactly what's going to work, we know that something's going to work. And we know that some things that are readily available already work. So for instance, most of my colleagues and people I know in this industry take metformin, which you'll be very familiar with, which is a frontline diabetic drug. Even if they're not diabetics, it probably has strong positive aging benefits. And in many countries, it's a non-prescription drug. So you can buy it readily, it's very cheap. And so when I remember to take it, I take that. And then in terms of supplements, the only one that I've been taking, but very intermittently, is the Juvenescence ketone ester, which is called Metabolic Switch. It actually tastes horrible. It's really not a nice drink to drink, but it does have the desired effect of putting people into ketosis, which we know is good for longevity. But these are, early stage things. We're much more excited by the stuff that's not yet readily available, but will become available, such as senolytic drugs, drugs to deal with some of the diseases of aging in a much more efficient fashion, and ultimately in gene therapy, which we think will be very important to this field. So as I said, we've got about 20 projects. 8 of those are pharmaceutical. A couple of those will be in the clinic over the next year or so. And we have a regenerative medicine side as well, focusing on stem cells and organ regeneration. And our liver regeneration program, which is done through a company called Ligenesis, which we own half of, is in phase 2 trials at the moment in sick patients in the United States, people who suffer from liver failure, where we're attempting to regrow liver tissue to take over from a failing liver. And we've done it very successfully in animal models. So the FDA allowed us to go straight into a phase 2 trial. If that works, then close behind that will be regeneration of the pancreas and kidneys, and the thymus, which is directly related to the aging immune system. And so we have a wonderful platform there to regenerate organs. And at the same time as we're doing that, we're trying to marry that technology with the stem cells that we have in our stem cell area, and particularly what are known as HLA-G stem cells, which are maternal stem cells, where the fetus isn't rejected by the mother. Those stem cells come into play then, and we're trying to use those stem cells to remove or reduce the need for immunosuppression post procedure for organ regeneration. And just to put this in perspective, if you have liver failure, and plenty of people do, there's nothing that can be done for you really, unless you get a liver transplant, and even the liver's transplant is not very certain, and there aren't enough livers by any means to go around. So, and the operation is 15 hours in the US. It costs $800,000. Our procedure is an outpatient procedure. It takes 20 to 30 minutes over about 3 doses. The patient is only lightly sedated. And within a year, the hope is that you have effectively a brand new liver, which takes over from your failing liver. So using lymph nodes as ectopic bioreactors seeded with hepatocytes. So it's really very exciting if we could, a bit like classic cars, if the parts can be replaced, then obviously the prospect of a longer and healthier life is much closer. And we're also very encouraged by some of the work done by other companies in the field. So the field is growing. There's more money coming into it, but as yet there isn't any magic potion in sight for us to give people so that they can live longer but certainly the prospect of them not having poor health in later life is closer, and that's what our team is working on. And we've got a very experienced team of scientists and other people in juvenescence, and who've brought lots of drugs to market. So we're confident that we'll have something in the relatively near future that will be, wow, and very, very important for patients and for humanity.
That's really interesting. Well, you mentioned.
Are you in Denmark, you too?
Yes.
Oh, right, okay. My father, who's still alive and in good health, was the British ambassador to Copenhagen, to Denmark, for 5 years. And he speaks fluent Danish, which is a rarity. So it's, we have a great family love for Denmark in our family. And my father has written 2 books in Danish.
Oh, wow.
And my brother-in-law is Danish, and one of my sisters was born in Denmark. So yeah, go Denmark. What else would you like to know?
Do you have like a favorite drug, or like one you like think has more potential than the others of all of these like different treatments plans you have mentioned?
Yeah, that's a great question. I think that the organ regeneration is probably, well, it is our most advanced project. And, we'll know within a year whether that works, which, if that does work, then it's going to be all headlines across the world, right? So I think that's our top. But in pharmaceuticals, we've got a project involving nausea, cachexia, anorexia, obesity, which is really exciting. And 2 of those drugs will be in the clinic in the next year or so. I think we were introduced through Alex Javronkov, who's a great guy, and Alex is doing great work in silico. We own a share of in silico medicine. We're very, very pleased with what he's done. He also started Deep Longevity, which in another company, Region Pacific, we've bought that, and we're excited about what work is going on there as well. We are also working on projects involving Alzheimer's, which is obviously a dreaded scourge, and we're also working in senolytic drugs, and we'll have more products from our consumer division, which is headed up by a very experienced team, over the next couple of years, including spermidine, which will be the next one on the market, coming probably by the end of this year. So the momentum is quite strong in the company. I mean, I don't think everything is going to work. Our first senolytic activities looked very promising, and then they've had to be refocused, as with so much in biotech. We've had some trouble with our stem cell company, but now that seems to be back on track. So there's always stuff that doesn't work out in biotech. This is a very important lesson for anyone who's involved in longevity or indeed in biotech. But that's the reason that we have these multiple bets. And I think we're very conscious of the fact that we're a longevity company. We're not a regular pharmaceutical company. So everything we do has got to improve healthy aging. We would expect to raise another big slug of money on our IPO, and that will again help us to broaden our opportunities, including gene therapy, which we think is going to be very, very important to longevity. It's a bit early at the moment, but we've identified a project there, and we're going to be doing stuff with that. But gene therapy ultimately, I think, will be the silver bullet for a lot of the diseases of aging. And it's a very important priority for us. So, the 3 founders of the company, myself, Greg, and Dec, own 51% of the shares of the company. And we're very committed to it. We won't be selling any shares at any time. We believe that this is our ability to contribute to human development in a very positive way. And as I said at the outset, I think the life expectancy at birth will be at least 110, within 20 to 30 years, and that will change everything. So there's all the societal implications of changing life expectancy, but there's no point in us living to 100 or 110 or 120 or whatever if the latter part of our lives is going to be characterized by severe illness. So one of the top priorities for us is to reimagine old age and to make it one that isn't burdensome to the individual, but rather where they continue to enjoy robust health until the end of their lives. So you are quite right to be involved in this industry, because it's going to be a huge one. There's no one really on the planet who doesn't want to live a longer and healthier life. Well, not many people anyway. I think you're exactly in the right area, but it's going to take patience. It's going to take fortitude, because there'll be many mishaps along the way. But I'm very encouraged by the progress of Juvenescence in the last 3 years, and the progress of other companies as well. So that towards the end of this year, we'll be announcing the Longevity Industry Association, which Juvenescence is a key co-founder of, and all the leading companies in the field will come together to make the mission more likely to succeed.
So you obviously are involved in many different aspects of longevity. Are there any trends you see happening in the next 10, 15 years? Perhaps some that you're not involved in currently?
Yeah, I mean, I do think that senolytics will be, which have been disappointing so far. And I don't know if you've followed Unity Biotech, but it's been disappointing because we thought that they might succeed with their senolytic for osteoarthritis, which is the leading cause of age-related infirmity. They're still in trials with their age-related macular degeneration drug, but that's been pretty disappointing. And our own senolytic, as I said, had to be refocused. But I do think someone's going to crack the senolytic. Then you've got rapalogs, analogs of rapamycin, I think will become important. Rapamycin is a golden drug in mammalian species and extending life and improving health. I think mitochondrial transplantation will be something that will be very interesting. But as we know, aging is a very complex cascade, and there isn't one thing that you can take. So there'll be multiple prongs to addressing it. But the great thing, and the reason that I'm so excited, is science is catching up with the aspiration of people to live longer. And the main catalyst for that is that the human genome was unveiled about 20 years ago, and people can effectively now read the map of life, or at least read it much better than they could before. And it makes it much easier to interfere with some of the key pathways of aging to reverse them. So I absolutely believe that in the next, you said 10 to 15 years, yes, we will have some products, some stuff out there which will slow at the very least, possibly halt, and maybe even reverse some aspects of aging, which is such great news because it's never happened in history before.
Do you then think in maybe like 20 years that people will take like drugs like that on a regular basis, just as we take vitamins today? Yes,
I do. So I think that there'll be drugs that people will take that will be a bit like statins or blood pressure pills, and they'll be taken on a daily basis. And then there'll be some intermittent treatments, such as using extending telomeres, for instance, or using some cell therapies, which again we're working on at the moment. So using transient Yamanaka factors as an example to refresh is the best way of describing it, the human body, and that all those things will be in wide dispersal within 20 or 30 years for the whole of the world's population. So this doesn't just become a luxury that is afforded to the the very wealthy, because patents typically in biotech run off. The period of commercial exploitation is only about 10 years. We live long lives, even today, relatively long lives. You know, if you make it to 65, you're very likely to make it to over 90. And so there's plenty of time for this to get into the general population. And so I'm absolutely convinced that we'll all be taking supplements that will be much more effective than just taking, you know, vitamin C or vitamin B or whatever people take at the moment, which, you know, is a matter of debate as to whether they work or not. But these ones that are going to be coming down the pike will be both prescription supplementation and also, or prescription medication, and also supplements that, like the way you just described it, that people take on a daily basis. And I think that the world will be a lot better. People will feel a lot happier, and will be living a lot longer and in robust health. So I do believe that Alzheimer's, for instance, will be cracked over the next 10 years. I think that the basic underlying issues causing diabetes will be cracked. I think many cancers are already being addressed very effectively, and that cancer could become a chronic rather than a terminal condition in many cases. And we already know that heart disease is declining because of effective medication and lifestyle changes by 1 to 2% per annum around the world. And heart disease is the biggest killer. So on the medical front, there is great reason for optimism, despite, you know, the interruptions of COVID and the risk of other pandemics and so forth. I think we should be optimistic about what's going on.
Yeah, so part of what we're trying to do here is to spread awareness about longevity field and get younger people engaged in longevity and want to go into longevity. So what advice would you have to younger people starting out their career who would want to go into longevity research or longevity industry?
Well, I think that, you know, I mean, obviously you guys have worked out that this is going to be a very exciting field for the whole of your lives, which could be very long lives, and that it applies to everyone on the planet. So if people want to get involved in it, what I would suggest is that you, rather than specifically start in a longevity company, I would either start in a research institution that has a longevity bent, something like the Buck Institute or Sense in the US, and both of which are excellent institutions, or you know, work for a biotech company or something related to biotech to get the relevant experience. Because I think just going out and saying I want to be involved in longevity without a clear plan or a clear product is going to be a hard road to travel. That having been said, there are some youngish people, I wouldn't say necessarily very young, but youngish people who are actively involved in the longevity field. And you'll be familiar with Laura Deming, who I know quite well, I think she's now 28 years old. She's an investor in the field, and she's effectively an accelerator. So she's helping small companies to grow out of San Francisco. And then there's Kristen Fortney, who's running BioAge, which I'm an investor in, who I don't know how old she is, but she's, you know, I think she's still in her 30s, and she's developing what is a really interesting series of repurposed in-licensed drugs for diseases of aging. Very exciting. And then, you know, I think that, you know, if you guys and your peer group are really interested, then, you know, just write to companies like Juvenescence and ask them whether they've got any openings, or, you know, if they know of people who've got openings or whatever. But it's all about networking, and you know, doing this series of interviews and podcasts that you're doing, I think gives you a major, first of all, insight into how the industry is evolving, which is very, very quickly. And secondly, who the key players are and how you might get involved with them. So keep on doing it is my advice.
Yeah, that's great. Do we have a question?
No, I'm pretty sure that was it.
Well, that's good. I think you did a great job with all the relevant questions, and It's a bit early to have a Carlsberg, but later on, I'm sure they
Yes.
have one. So, and have a great weekend. Thank you.
Thank you. Thank you so much.
Thanks very much. Thanks a lot. Bye. Bye.
Bye.